Hi, this is Tank 12. This is Christina Rodriguez Fierro. We have Robert Quiring and Josh King. So for the introduction, our cadaver was a female. She was Caucasian. She died on 12/27/2016. Her last occupation was listed as homemaker, and her cause of death was listed as cirrhosis of the liver. We're going to start with the heart. Our cadaver had left coronary occlusion, about 90%. This variation may have indicated that our cadaver most likely suffered from severe coronary atherosclerotic disease, and this is cited as being the most common cause of left coronary occlusion. This type of occlusion can lead to a diminished tolerance to exercise and angina. We, however, were not provided with information concerning our patient's cardiac history, so we can only assume that she probably suffered from these symptoms. We've included a picture here to show what occlusion of the left coronary artery looks like due to buildup of plaque. Our cadaver was also suspected of having a mural thrombosis in her right ventricle. Here we included a picture where you can see cardiac mural thrombi in the ventricles of the heart. The presentation of a thrombus in our cadaver's right ventricle indicated that our cadaver may have suffered an acute anterior myocardial infarction. If she did in fact suffer from an acute MI that led to a thrombi formation, it seems likely that this was probably a result of the 90% occlusion of her coronary artery. It has been found that patients with fatal acute MIs do in fact have higher frequencies of mural thrombi.
This is Josh, and I'm going to talk about our cadaver's liver. Upon opening our cadaver's abdomen during dissection, it was readily apparent that she had pretty significant hepatic cirrhosis. Cirrhosis is the result of prolonged tissue scarring, which can be the factor of genetic or poor diet, alcoholism, or viral infection. Some of the symptoms of hepatic cirrhosis include, but are not limited to, jaundice, ascites, chronic fatigue, and easy bruising. There are 4 stages of cirrhosis. Hepatic cirrhosis, which chronicle the varying degrees and presence of varices and ascites, which are the 2 more common signs of cirrhosis, both of which are a result of fundamental restructuring of the liver due to destruction of the liver cells with fibrosis. Some of the anatomic variations that we saw under the microscope where she had some macronodular cirrhosis and lesions indicative of a liver infarct. The slides showed possible acute kidney injury, but we were unable to determine this, and that's because the hepatocytes autolyzed due to the embalming process, and this presents the same histologically speaking. Also, nonspecific interstitial edema, and her glomeruli appeared intact mostly. Some of the treatments for cirrhosis are low sodium diet, cessation of alcohol consumption, antiviral drugs, and ursodiol, which is the primary treatment for biliary cirrhosis. But at the end of the day, cirrhosis is not curable, but it is treatable.
Although we discussed the heart previously, to kind of go back on the heart and talk about some more of the histology of our cadaver, this histological slide of our heart showed evidence of what appeared to be scar tissue. And this scar tissue could have actually been the result from either like myocardial ischemia or high afterload. And so to talk more about the last organ that we saw that was potentially affected was her kidney. She, like we mentioned before, they showed evidence of potential acute kidney injury, and this renal dysfunction could be a common complication of liver cirrhosis, which is what we discussed previously. It could also be related to abnormal hemodynamics of systemic and splenic arterial vasodilation, and this prerenal acute kidney injury and acute tubular necrosis represents most of causes of AKs in cirrhosis. So this picture right here that we have included, a slide, is actually from an outside resource. Just kind of looking at more of the histology of what we would definitely see in acute tubular necrosis. The blue arrows kind of show some of the loss of brush border in the proximal tubule, and then the orange arrows show some flattening of those renal tubular cells. And then the yellow arrows actually point to some cast formation that could be seen with acute kidney injuries, and then the red arrows show just some granular cast that could be seen. And so this slide right here is from our cadaver specimen. And so if you look at the blue arrow to the top right picture, you'll see what looks like maybe either blood in tubules or maybe some potential cast formation that kind of got caught up with some of the mucoprotein matrix complex. And then just another selection of the slide to the bottom right, we see maybe some flattening of our tubular epithelial cells and dilation of the tubes and potential loss of brush border on the proximal tubule. So in summary, liver cirrhosis in our cadaver most significantly attributed to overall health outcome, particularly in the acute kidney injury. In the heart, like we described before, there's ventricular thrombosis and left coronary artery occlusion. Again, in the AKI, there is loss of epithelium in the lining the tubule, and the liver cirrhosis most definitely impacted her health and ultimately could have contributed to her death. And we suspected that the cause of death was heart failure secondary to liver cirrhosis. And here are the references. And thank you for taking the time to watch our presentation.